This recorded lecture will be going over Chapter 17, Drugs for Osteoporosis and Hormonal Problems, in the Introduction to Clinical Pharmacology textbook. Osteoporosis is a condition that causes the bones to become brittle from the gradual loss of bone density. This is typically due to hormonal changes or a deficiency in vitamin D or calcium. Old bone cells are continually removed by a process known as osteoclastic activity, and new bone cells are continually added by a process known as osteoblastic activity. For bones to remain strong and dense, these two processes must be balanced. Osteoporosis will result when the body's process of breaking down bone in order to build it up again, or the osteoclastic activity, occurs at a faster rate than osteoblastic activity. Osteoporosis is commonly more severe in women after menopause, but it does occur in people of both genders at any age. The rate and degree of bone density loss will vary from person to person, but it does occur to some degree in everyone during the aging process. Factors that influence at what age a person will develop osteoporosis and how severe it will be include genetic predisposition, nutritional status, amount of weight-bearing activity, cigarette smoking, presence of sex hormones, and drug use. Although osteoporosis cannot be cured or completely prevented, its progress can be delayed with drug therapy. Drugs and supplements that are used to manage this disorder include biphosphonates, estrogen agonist and antagonist, osteoclast monoclonal antibodies, sclerostin inhibitors, synthetic parathyroid hormone, calcium, and activated vitamin D. Bone density requires a constant supply of calcium, and dietary calcium requires activated vitamin D for absorption from the intestinal tract. Supplements of calcium and vitamin D are needed for osteoporosis management. Biphosphonates are calcium-modifying drugs that are used to prevent and manage osteoporosis. Biphosphonates act by binding to calcium in the bone and preventing osteoclasts from destroying bone cells and reabsorbing calcium. All biphosphonates increase bone density, reducing the risk of fractures in the spine, hip, and other bones. Biphosphonates contain nitrogen, and their effectiveness requires that patients have an adequate intake of calcium and vitamin D. Common side effects of biphosphonates are headache, esophageal reflux, and nausea. Teach your patient and family the following. Take biphosphonates early in the morning, typically right after breakfast, and drink a full glass of water. Then remain in an upright position for at least 30 minutes after taking the drugs. Inform your dentist or oral surgeon that you are taking a biphosphonate before a tooth extraction or invasive dental procedure. And report any swelling, pain, redness, or other signs of infection in the gums that could indicate osteonecrosis. An estrogen agonist or antagonist is a drug for osteoporosis that activates estrogen receptors in the bone to help calcium remain in the bone and then blocks or antagonizes estrogen receptors in the breast tissue and uterine tissue. These opposing responses increase bone density and prevent excessive growth of breast tissue and overgrowth of uterine endometrial tissues. Common side effects of these drugs include hot flashes, increased blood pressure, joint or muscle pain, nausea, indigestion, lower extremity edema, difficulty sleeping, and weight gain. Estrogen agonists and antagonists should not be used by patients who have had a previous thrombolytic event or who smoke. Teach your patient and family the following. To prevent dangerous blood clots that could cause a stroke or heart attack, do not smoke while taking this drug. To prevent swelling of the lower extremities, avoid excessive dietary salt and sodium intake. Osteoclast monoclonal antibodies are laboratory-made drugs that are designed to serve as substitute antibodies to target immature osteoclasts. Binding of the antibodies to those cells prevents them from maturing and reducing bone density. This drug has some dangerous side effects and is recommended only to treat severe osteoporosis in patients who have tried other treatments that were not effective. Rashes and muscle and joint pain are the most common side effects of osteoclast monoclonal antibodies. The risk of severe allergic reaction increases with repeated doses of the drug. Assess your patient for an allergic reaction during and after subcutaneous injection of Prolia. Keep emergency equipment in the room with the patient. Teach your patient and family the following. Inform your dentist or oral surgeon that you are taking Prolia before any dental procedures. If you are having chest pain, shortness of breath, or dizziness, or just don't feel right when you're receiving this drug, call for help immediately. Report any swelling, pain, redness, or other signs of infection that could indicate osteonecrosis. Sclerostin is a glycoprotein that is produced by osteocytes. When sclerostin is inhibited, osteoblast activity becomes stimulated and results in the formation of new bone. Sclerostin inhibitors are used for patients who are at a high risk for fracture or for whom other therapies of osteoporosis have failed. Sclerostin inhibitors are contraindicated for patients with hypocalcemia. Hypersensitivity reactions would include swelling of the mouth or lips, or a rash. There is a risk of osteonecrosis of the jaw, which can occur without warning. The most serious adverse effect is the risk of cardiovascular events. Evenity is a drug only given by a healthcare provider. Teach your patient and family the following. Inform your dentist or oral surgeon that you are taking this drug prior to any dental procedures. This drug can cause hypersensitivity reactions, so report them to your physician and call for help immediately. Report any signs of swelling, pain, redness, or other signs of infection that could indicate osteonecrosis. Teriparatide injection, or Forteo, is a synthetic form of the natural human parathyroid hormone. It is classified as an anabolic drug because it promotes rapid bone growth. When PTH is given, new bone forms soon afterwards because osteoblast formation is increased and the cell death of the osteoblast is prevented. This results in new bone formation. This drug is used to treat postmenopausal osteoporosis in women and osteoporosis resulting from hypogonadism in men who are at a high risk of fracture. Bone pain is the most commonly reported side effect. Other side effects include nausea, dizziness, and injection site reactions. Other adverse effects include angioedema and severe allergic reactions. Orthostatic hypotension can occur with the first few doses. So monitor your patient's blood pressure in the lying, sitting, and standing positions to assess for orthostatic hypotension. Teach your patient and family the following. Teriparatide is given subcutaneously using a 20 microgram 2.4 ml pre-filled syringe. This drug can cause allergic reactions, so report any swelling of the lips or rash immediately. The roles of calcium and vitamin D in the treatment of osteoporosis for prevention of fractures is questionable. The bones do contain 99% of the total calcium within the body. Standard recommendations for postmenopausal women with osteoporosis are to consume 1,000 to 1,500 milligrams of calcium and 600 to 800 international units of vitamin D every day. The side effects of calcium and vitamin D supplementation include nausea, vomiting, constipation, bone pain, muscle weakness, and increased thirst. Calcium and vitamin D tablets should be given with food. Teach your patient and family the following. Calcium and vitamin D tablets do come in different strengths, so be sure that you have the correct strength recommendation for you. Take these medications with food. If using the liquid form of the supplement, carefully measure the dosage using an accurate measuring container. If taking the chewable form, chew the drug carefully and do not swallow it whole. Do not crush extended release forms of the drug, and eat a diet that is rich in foods containing calcium and sources of vitamin D. The endocrine system involves many glands that secrete hormones. We'll remember that a hormone is a protein secreted by an endocrine gland that changes the action of another gland or tissue, known as its target tissue. Unlike some glandular secretions, like from the salivary glands, that have to move through a duct to get directly to their site of action, hormones do not require a duct to reach their target tissues. For this reason, endocrine glands are known as ductless glands. When a specific hormone, such as insulin, reaches a tissue or organ that has insulin receptors, the hormone recognizes its target tissue and then binds to those receptors, causing a change in the activity of the target tissue. The regulation of hormones works on a negative feedback loop. We know that many hormones are necessary for life. Some hormones, like estrogen, can be useful at different times during a person's life, but are not essential for maintaining critical physiologic functions. Depending on how important the function of the hormone is to a patient's health and well-being, hormone replacement therapy, which is a temporary or permanent therapy with drugs that perform the function of natural endocrine hormones, could be needed. HRT can be used for a short time, like as for relief of menopausal symptoms, or it can be used permanently, such as for the replacement of thyroid hormones after the removal of the thyroid gland. And we can see a picture of the endocrine system on page 312 that goes over the different organs contained in this system. The thyroid gland in the neck produces two thyroid hormones that are critical for life: thyroxine, also known as T4, and triiodothyronine, also known as T3. These hormones are critical for the following body actions: brain development and function, including the ability to think, remember, and learn; heart and skeletal muscle contraction and strength; endocrine system production of other hormones; breathing and oxygen use in all cells. Hypothyroidism, also known as underactive thyroid, is a common problem in which the thyroid gland produces little or no thyroid hormones. This slows all aspects of metabolism. Other symptoms, such as weakness, fatigue, weight gain, or depression, can also occur. These problems can be prevented by HRT with drugs known as thyroid hormone agonists. Therapy is typically needed for the rest of the person's life. A thyroid hormone agonist is a drug that mimics the effect of the thyroid hormones, T3 and T4, which helps them to regulate metabolism. These drugs work like natural thyroid hormones by moving through the blood and entering all cells. Thyroid hormone agonist drugs have a few side effects because they do mimic normal hormones. The symptoms most easily noticed are diarrhea, rapid pulse, high blood pressure, difficulty sleeping, excessive sweating, and heat intolerance. The most serious adverse effects of the thyroid hormone agonists occur only in the cardiac and nervous systems. The activities of both systems will increase, sometimes to dangerous levels. When thyroid hormone agonists are taken with drugs that reduce blood clotting, especially warfarin, their actions will be increased. This response can cause excessive bleeding and bruising. Before giving the first dose of a thyroid hormone agonist drug, check the patient's heart rate and blood pressure because these drugs can increase metabolic rate and cardiac activity. Report the use of anticoagulants or NSAIDs to the healthcare provider because these drugs can interact with thyroid hormone agonists and cause excessive bruising and bleeding. Pregnant women may need a higher dose, and women who are taking thyroid hormone agonists are advised not to breastfeed because the drug can be found in breast milk. When hypothyroidism is first diagnosed, the thyroid hormone drug dose is kept low for the first several weeks. The drug dose is then increased slowly every 2 to 3 weeks until the patient has normal blood levels of thyroid hormone and signs of normal metabolism. You should give this drug 2 to 3 hours before a meal or fiber supplement, or at least 3 hours after a meal or fiber supplement has been taken. The effects of the drug may not be apparent for several weeks. The following changes would indicate that this drug is effective and the dose is appropriate. The patient's vital signs should be within normal limits. Their activity level and mental status should feel normal for them. The patient's body weight should be consistent with the number of calories consumed and/or their activity level. And the patient's bowel habits should be what they were before the thyroid problem occurred. Assess your patient for indications of adverse side effects on the cardiac system. The first indication could be chest pain or discomfort, as well as hypertension. For patients who are taking drugs that affect their blood clotting, especially warfarin, assess the patient at least once per shift for any signs of increased bleeding. Teach your patient and family the following. Take only the dose that is prescribed to you, because increasing the drug too quickly can lead to adverse effects. Do not skip doses. You must take the drug daily to maintain normal body function. If you do miss a dose, take it as soon as you remember it. However, if it's almost time for your next dose, you should skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. To prevent underdosing or overdosing, don't stop the drug suddenly or change the dose. Take the drug 2 to 3 hours before a meal or fiber supplement, or at least 3 hours after a meal or fiber supplement, because food and fiber will greatly decrease absorption of the drug. Check your pulse every morning before taking the drug, and again every evening before going to bed. If your pulse rate becomes 20 beats higher than your normal rate for 1 week, or it becomes consistently irregular, notify your healthcare provider. Go to the emergency department immediately if you begin to have chest pain. If you are ill and cannot take the drug orally, contact your healthcare provider to get an injection dose of the drug. If you also take warfarin, keep all of your follow-up appointments and appointments for any blood clotting tests. Avoid any situations that could lead to bleeding and any other drugs, like aspirin, that could make that bleeding worse. Hyperthyroidism is also called an overactive thyroid or thyrotoxicosis. This is a condition in which the thyroid gland secretes excessive amounts of those thyroid hormones, T3 and T4. The hormone generally causes excess. This hormone excess causes general body metabolism to be greatly increased. Some types of hyperthyroidism cause the patient to have a goiter. This is a swelling in the neck caused by an enlarged thyroid gland. When hyperthyroidism is caused by Graves' disease, bulging or protruding eyes and blurred vision can occur. Severe hyperthyroidism that causes life-threatening hypertension, heart failure, and seizures is called thyroid crisis or thyroid storm. A fever will often be the first indication of the problem. This condition is an emergency and can lead to death if the thyroid hormones are not decreased immediately. Therapy with antithyroid drugs can be used short-term, before surgery, or long-term to prevent thyroid hormone production and control the disease. Methimazole and propylthiouracil are common antithyroid drugs and belong to the thionamide class of drugs. These drugs are not interchangeable because methimazole is 10 times stronger than propylthiouracil. Antithyroid drugs work directly in the thyroid gland to stop production of new hormones by preventing an enzyme from connecting iodine with tyrosine to make the active thyroid hormone. The drug serves as a decoy for the enzyme, so instead it works on the drug rather than connecting these two substances. The drugs do not affect stored hormones, so it could take several weeks before the effects of the stored thyroid hormones are gone. On page 316, see the purple tip for safety. Teach patients that thyroid-suppressing drugs must be taken for 3 to 4 weeks to start being effective. because they will have no effect on thyroid hormones already stored in the thyroid gland. Most common side effects of antithyroid drugs are minor and include taste changes, headache, itchiness, rash, muscle and joint aches, drowsiness, nausea, vomiting, enlarged lymph nodes, and swelling of the lower extremities. Bone marrow suppression can occur, causing anemia and increasing the risk of infection. Propylthiouracil can be hepatotoxic. In some patients, these drugs can also damage the kidneys. Both methimazole and propylthiouracil increase the effectiveness of anti-clotting drugs, especially warfarin. Patients who are taking antithyroid drugs with any anti-clotting drug are at a greater risk for excessive bleeding and bruising. Check your patient's blood count. Check your patient's blood counts for signs of bone marrow suppression, such as a low white blood cell count, anemia, or thrombocytopenia. Before giving these drugs, check their liver function tests because both will be toxic to the liver. Carefully check the dose and the specific name and the prescribed dosage. Check the patient's complete blood cell count whenever it is determined because these drugs will cause some degree of bone marrow suppression. Bone marrow suppression can increase the risk of bleeding. These drugs increase the action of anti-clotting drugs. Check your patient daily for yellowing of the skin or sclera, coffee-colored urine, and clay-colored stools. These are all symptoms of liver problems. Teach your patient and family the following. Even if you don't notice a reduction in symptoms in the first 1 to 2 weeks, do not increase the dosage on your own. These drugs do take several weeks to become effective. Keep all follow-up appointments and appointments for blood clotting tests because these drugs increase the effectiveness of warfarin. Avoid any situations that could lead to bleeding or drugs that make bleeding worse. Avoid crowds and people who are ill because these drugs can reduce your immunity and resistance to infection. Check the color and roof of the mouth and the whites of your eyes daily for a yellowing tinge that could indicate a liver problem. If this appears, notify your healthcare provider as soon as possible. The adrenal glands are a pair of small endocrine glands located on the top of the kidneys, although they are not part of actual kidney function. In addition to sex hormones, the adrenal cortex secretes aldosterone and cortisol. Both of these are steroid hormones, also known as corticosteroids. That means that their main structure is composed of the steroid cholesterol. Aldosterone controls sodium and water balance. It is also known as a mineral corticoid because it regulates sodium. Cortisol, of which there are many different types, has many functions and it is essential for life. Cortisol helps maintain critical blood levels, the stress response, excitability of cardiac muscle, immunity, and blood sodium levels. Cortisol is called a glucocorticoid because it was first discovered to affect blood glucose levels. Adrenal gland hypofunction is a disorder in which the adrenal gland produces little or no cortisol and aldosterone. Conditions that cause reduced adrenal gland function include an autoimmune disease that attacks and destroys the adrenal glands, adrenalectomy, abdominal radiation therapy, and reduced function of the anterior pituitary gland. Major problems resulting from adrenal gland hypofunction are hypoglycemia, salt wasting, hypotension, weakness, and high blood potassium levels. Without replacement of cortisol and aldosterone, adrenal gland hypofunction will eventually lead to death. Although glucocorticoids are used for HRT, their most common use is as a powerful anti-inflammatory drug. Glucocorticoid drugs act like natural cortisol. Fludrocortisone is a synthetic drug that acts like natural aldosterone. With the use of this drug, more sodium is retained and then more potassium excreted to prevent dangerously high potassium levels. Side effects of fludrocortisone therapy include hypertension, edema, low blood potassium levels, and high blood sodium levels. Heart failure is a serious adverse effect of fludrocortisone. If heart failure develops, the drug dose will be reduced or stopped. It's important to assess weight daily. Teach your patient and family the following. Take fludrocortisone at the same time daily with food to prevent any GI problems. Weigh yourself daily and keep a record because the drug can cause fluid retention with weight gain, edema, and heart failure. Report edema of the lower extremities because this could be a sign of heart failure. And report any weight gain of 2 pounds in a day or 3 pounds in a week to the healthcare provider immediately. Most of the time when adrenal gland hyperfunction occurs, only one hormone is oversecreted. Excessive secretion of cortisol is known as hypercortisolism, or Cushing's disease, or Cushing syndrome. Excessive secretion of aldosterone is known as hyperaldosteronism. The most common cause of adrenal gland hyperfunction is an adrenal gland tumor. Surgery is the most common treatment for adrenal gland hyperfunction that is caused by a problem in the adrenal gland. Drug therapy can help manage problems caused by adrenal gland hyperfunction before surgery, as well as for patients who are unable to have the surgery. Some of these drugs reduce cortisol production, whereas others help control the problems caused by the hyperaldosteronism. Drug therapy for hyperaldosteronism focuses on reducing potassium levels and relies on spironolactone, a potassium-sparing diuretic. Common side effects for drugs that suppress adrenal hormone production are likely to cause nausea, vomiting, rashes, and dizziness. Any drug that suppresses adrenal gland production of cortisol can lead to problems of adrenal insufficiency. Teach patients who are taking any drug that suppresses adrenal hormone production the signs and symptoms of adrenal insufficiency. Common indicators would be salt craving, muscle weakness, hypotension, hypoglycemia, and fatigue. Teach your patient and family the following. Keep all appointments for laboratory blood work because these drugs do alter blood levels of sodium and potassium. Report symptoms of adrenal insufficiency to your healthcare provider immediately. Take these drugs with food because they can cause GI upset. If you are a sexually active woman in your childbearing years, you should use 2 reliable forms of birth control while taking this because mifepristone is a drug that can cause pregnancy loss. Hormones secreted throughout a woman's menstruating years will promote conception and pregnancy. Estrogen is the main female sex hormone secreted by the ovaries and adrenal glands. Secretion of gonadotropin-releasing hormone from the hypothalamus in the female will stimulate the release of 2 hormones from the pituitary gland, follicle-stimulating hormone and luteinizing hormone. Functional pregnancy resulting in birth requires conception, continued secretion of estrogen and progesterone, successful implantation 5 to 8 days after conception, and placental development. Menopause is the period in a woman's life when menstruation and ovulation no longer occur. This happens due to age-related changes that make the ovary stop functioning. Perimenopause is defined as the transition from having regular menstrual periods based on hormone cycles to having no menstrual periods for at least a full year as a result of reduced hormone cycles. As a result of negative feedback, decreased blood levels of estrogen trigger the brain to secrete GnRH. This forces the pituitary gland to over-secrete FSH. However, the FSH no longer has any effect on the ovary because its cells are no longer functional and blood levels of the estrogen will remain low. The extra FSH does not have any effect on the ovary, but it can cause responses in other body tissues. Symptoms of menopause are caused by low levels of estrogen and high levels of FSH. Menopausal HRT during the perimenopausal period consists of replacement of naturally secreted estrogen and progesterone with hormones given in the form of a drug. Giving a woman low doses of estrogen mildly increases blood estrogen levels. This helps to reduce the perimenopausal symptoms and suppresses the feedback system to lower FSH levels. The most common side effects of perimenopausal HRT include breast tenderness, breakthrough bleeding, fluid retention, weight gain, and acne. These can occur with estrogen alone and when estrogen is combined with progesterone. Women who are taking estrogen-based HRT have a slightly higher incidence of MI. Estrogen and progesterone drugs also increase the risk of blood clotting and the inappropriate development of thrombi and emboli. These risks do increase with age and are greatly increased with cigarette smoking. Perimenopausal HRT promotes the growth of hormone-sensitive cancers of the cervix, uterus, ovary, and breast. Perimenopausal HRT has also been associated with liver impairment, gallbladder disease, and pancreatitis. Teach your patient and family the following. Take drugs for perimenopausal HRT exactly as prescribed with regard to dosage and timing. Quit or reduce smoking while taking these drugs. Check the color of the roof of your mouth and the whites of your eyes weekly for a yellow tinge because these drugs can impair the liver. Go to the ER or call 911 immediately if you have chest pain, difficulty breathing, swelling in one leg, or any symptoms of stroke. Taking HRT for long periods of time does increase the risk of cancers of the cervix, breast, ovary, and uterus. So discuss the optimal length of time for taking these drugs with your healthcare provider. Hormonal contraception is the use of hormones to suppress ovulation for the intentional prevention of pregnancy. When used correctly, hormonal contraception is highly effective. These hormones can be taken orally, used as topical applications in the form of transdermal patches, vaginal rings, or intrauterine devices. They can be implanted under the skin or injected parenterally as a slow-absorbing form. Oral contraceptives, also known as OCs or BCPs, are the most commonly used form of hormonal contraceptive. The mechanism of action and side effects of hormonal contraception are the same for all forms. OCs provide enough estrogen and/or progesterone to signal the hypothalamus that further secretion of these hormones is not necessary. Ovulation does not occur. The cervical mucus thickens, making fertilization difficult, and the lining of the uterus becomes too thin to support pregnancy. The most effective OCs contain a synthetic estrogen and progestin, a synthetic progesterone. Mini pills are OCs that contain only progestin rather than a combination of estrogen and progestin. These increase blood levels of progesterone, turning off the hormone pathway with positive feedback. This does prevent ovulation. Many pills are not as effective as combination OCs, and most must be taken daily and continuously. The most common side effect of OCs are breast enlargement and tenderness, nausea, fluid retention, and weight gain. Like other types of sex hormones, OCs increase the risk of blood clot formation. This problem can lead to DVT, PE, MI, and stroke. The risk increases among women who smoke and those older than 35 years of age. Most hormonal contraceptives cause fluid and sodium retention, which can lead to hypertension. The estrogen and progestin in OCs can cause liver toxicity. The estrogen and progestin of OCs also promotes the growth of hormone-sensitive cancers of the cervix, uterus, ovary, and breast. OCs that use drospirenone as the progestin can increase the serum potassium level. This can lead to heart block and other irregular heart rhythms. Many drugs and herbal supplements will interact with OCs. So teach your patient and family the following. Use an additional method of contraception during the first cycle because OCs do require a full cycle before they are effective. Take this drug as prescribed, or unplanned pregnancy could result. Remember that OCs are effective at preventing pregnancy, but only when taken exactly as they are prescribed. Take the OC with food once daily and at the same time every day for the best effect. Do not smoke or use nicotine in any form to reduce your risk of blood clots, heart attack, and stroke. If you miss one dose during your monthly cycle, the drug should still be effective in preventing pregnancy. However, if you miss more than one dose in a cycle, especially 2 doses in a row, you should continue to use it, but also use a backup method of birth control for the rest of your cycle. Tell other healthcare providers that you are taking this drug. To prevent possible interactions, don't take any other over-the-counter drugs prior to checking it with your healthcare provider. Notify your healthcare provider if you develop yellowing of the skin or eyes, darkening of urine, or lightening of the stools. These problems are all signs of liver toxicity. The male hormone testosterone and its related hormones are called androgens. Androgens are synthetic or natural hormones that help to develop and maintain the male sex organs at puberty and develop secondary sex characteristics in men. They promote the anabolic or tissue building processes in the body. Anabolic steroids are synthetic drugs with the same uses and actions as androgens. These drugs can be given as replacement therapy for testosterone deficiency. Androgens are steroid hormones that are synthesized from cholesterol in the adrenal gland. They stimulate or control the development and maintenance of male characteristics, including the activity of the male sex organs and the development of male secondary sex characteristics. Androgens and anabolic steroids are primarily used in the treatment of hypogonadism, hypopituitarism, eunuchism, cryptorchidism, oligospermia, and general androgen deficiency in males. The most commonly used androgen is testosterone. Common side effects of androgens include edema caused by sodium retention, acne, hirsutism, male pattern baldness, mouth irritation, diarrhea, nausea, and vomiting. Tumors of the liver, liver cancer, and hepatitis have occurred with long-term, high-dose androgen therapy. Adverse reactions to androgens also include jaundice, decreased sperm count, gynecomastia, impotence, and urinary retention. Androgens and anabolic steroids can increase the effectiveness of anticoagulants, antidiabetic agents, and other drugs. Teach your patient and family the following. Take the drug as instructed by your healthcare provider. Do not increase the dose without consulting your healthcare provider, even if you don't see expected effects within the first 1 to 2 months. The response to this drug can sometimes take several months. Report any new or troublesome symptoms that do develop, including fluid retention, breast enlargement, shortness of breath, excessive physical or sexual stimulation, prolonged or painful erection of the penis, impotence, urinary retention, and jaundice. If you are taking the drug under the tongue or putting the drug in your cheek, do not eat, drink, smoke, or chew tobacco until the drug has completely dissolved for best absorption. If you're using a topical gel form of the drug, do not let women or children come into contact with the areas where you have applied it to prevent them from absorbing the drug.